Good evening, ladies and gentlemen. It's nice to see you on this lovely evening. Yeah. My first comment is getting out of Woodley is more like getting out of prison. Or perhaps it's easier to get out of prison, I don't know. But I'm sorry I'm a bit on the last minute. Welcome to the HOSC meeting. It's good to see Kay here because she and I were on the HOSC when we started HOSC, weren't we? A few moons ago. Nice to see you, everyone. We have some apologies for absence. Madeline.
So Alison Swaddle and Lou Timlin and Adrian Mather and Kay Gilder and Carolyn Smith are substituting.
Lovely, thank you. Welcome, everyone. First of all, the minutes of the previous meeting on page 5 of the agenda. Is everyone happy that I sign them as a true record of the meeting? Right, thank you very much. Any declarations of interest? We have no members' public questions. We have no member questions. We could be finished in 10 minutes if we carry on. Oh, did I give you the look? Adult services, self-assessment and peer review. Matt, over to you.
Let Michelle sit down. Good evening, everyone. I'm just trying to remember back to the last committee we talked about forward planning, didn't we? And I'm pretty sure I would have said, but just to remind you, all local authorities' adult social care functions are now subject to a new government assurance regime, which is run by Care Quality Commission, or CQC. So this is about this. I suppose there's 2 papers in here, but they're the same objective. This is about just getting committee here close to our preparations for that, and we'll talk that through in a minute. Now, it is quite a long and detailed assurance program. Some would say inspection. So today is aimed at being a summary, I suppose, of that, and to kind of get you as a committee to sort of understand where that is. We do have a full self-assessment document which looks at the whole of adult social care against the inspection criteria, which we can share maybe at a later date if we want to go into a bit more detail. I think I've missed introductions, so I'll do that now because there's 1 or 2 of us here today, because this covers the whole of the adult social care function. We've got pretty much everyone here tonight who is sort of covering all bases. So I'll do a quick bit of introduction. I think you all know me. I'm Matt Pope. I'm the director. Liz, do you want to go first? You have to.
Hello, everyone. Okay, I'm Liz Tate. I'm Assistant Director for Integrated Mental Health. So I'm in a joint post with Wokingham and Berkshire Healthcare Foundation Trust.
I'm Wes Hedger, and I'm the Assistant Director for Strategy and Commissioning and Adults Performance.
Lisa?
Hi everybody, I'm Lisa Evans. I'm the Assistant Director for Operations and Adult Social Care, all of the social work teams and OT teams.
I'm Beth Rowland. I'm the current chair of the HOSC.
Rochelle Shepherd-Dubay, fire service mainly more than anything else.
Hi, Rebecca Margetts.
Hi, Caroline Smith. I'm substitute. Thank you.
Shona Turtle. Is that on? Shona Turtle.
Kay Gilder, I'm a substitute.
Sarah Bell.
Again, Agila.
And I think we missed David out. So you may all know David as lead member, but it's worth that.
But I'm David Hare. I'm the executive member for Adult Services, Health and Wellbeing.
And we may have one more person online. It's difficult to see. No, not Ingrid.
Evening, I'm here, Ingrid, Director of Public Health in Wokingham. Nice to see you all.
Health Watch, would you like to introduce yourself?
Good evening, everyone. Can you hear me? Yeah. Good evening, everyone. I'm Alice Clifton. I'm the lead officer for Health Watch Wokingham.
Okay, so I think you've had some papers which are presentations. So I'm just going to go through those in case you haven't had a look through those. And as if by magic, Wes is going to seamlessly presentation up. So this is just a bit of a background to what the assurance regime or inspection regime is. As you can see, I suppose this presentation was done a little while ago, so it talks about pilot assessments and then 9 reports were carried out. There's actually quite a few more than that now. It's been running for about a year. I think, Wes, you've got a map in a minute, haven't you, where we can look at how far around that is. So although very recently we were saying the government's just getting started with this, it's about a year into the programme now. And West Berkshire have had their inspection and outcome. Bracknell have had their inspection and outcome. Windsor and Maidenhead are just at the end of their inspection and assurance programme, and Reading are undergoing theirs at the moment. So it gives you a sense that it's coming soon and it's all around us. I think you can see just a map of the country there, just gives you a brief overview of where we're in the other category at the moment, and we're preparing for our visit. Next, Wes. Can we just go back to the first slide, just checking that I didn't miss anything off there. I'll go. We've got a little flowchart which kind of brings to life what will actually happen, but essentially there's an assessment framework which is made up of 9 quality statements across 4 themed areas, and you're assessed against that. And the CQC will look at all the public data that we publish, data returns that we publish. They will look at, they ask for a huge information return, which we produce. That's quite prescriptive. That looks at data, statistics, policies, strategies, a whole range of information, including our self-assessment, which is our assessment of where we feel we are. And there's a summary of that here, but we might be able to share the whole of that with you at some other point. And then they look at cases, they track cases. So they'll take a sample of 50 cases. There's a whole criteria around that. And then from that, they choose a number to track through. They call people who draw on our services, families, and then they talk to a whole group of staff. They come on site and talk to staff, partners, and other groups. So that just sort of gives you a sense of it's quite an undertaking. And then at the end, you get a score. So each area is scored, and then you get a kind of score out of 100, and then you will end up with a 1-word judgment: inadequate, requires improvement, good, or outstanding. I know there's been quite a bit in the media, hasn't there, about Ofsted and one-word judgments around schools. Although there's been some announcements from the government around changing that regime for Ofsted and schools and children's services, the CQC haven't said anything about whether they're going to look to change that for their adults assessment framework or decisions framework. Okay, next. Thank you. What I've done, or what we've done here, is just at a very high level take out of our self-assessment where we think our strengths are and where we think we are looking to improve, which are the next two slides. It is quite high level because the document itself is, I think, 73-ish pages long. So we've attempted to do that at a fairly high level for you. I don't think I'll go through all of those one by one, but you know, when I finish presenting, if people have questions or want any clarity, then we can go back to those. So if we move on, and that's the same for our identified improvement themes. You can see those listed on the page, and that doesn't necessarily mean that we feel that there's poor performance in those areas. They're just areas where we think we need to you know, drive improvement across the board, or they're bits of adult social care that we want to concentrate on or do a bit of a deep dive into. This looks a bit busy, doesn't it? But essentially, it just gives you a sense of how the process works. I think one of the things to say is lots of people might be more sort of understanding of what happens in children's services, in that in children's services, social care inspection, you tend to get a call, and then the very next day, Ofsted can kind of be on site, and then it's all kind of done. That's not how the CQC have arranged this. It's a more longer and drawn out process. You know, different opinions about whether that's good or bad. So essentially, when you get notified that you are going to be part of the assurance process, you then get 3 weeks to upload all of your information. That takes you to the little break bit there. And then there's a whole pre-site visit 6 to 8 week period where the insurance team are looking at what you sent them. They're doing the case tracking and thinking about that. Then you do get a site visit, and that can be over a number of days. And then, as you can see, a report is pulled together. You get a draft report. There's a factual accuracy review, and then you get a final report. And some councils have experienced that taking 6 months end to end in total. Some a shorter period than that, but it can take quite a long time. I think that is there a next step slide? So we have our self-assessment document, which is now complete. I think Wes has a copy here. We've given you a summary of that, but if we want to do a bit more follow-on or a deep dive into that in further committee meetings, we can do that. We can certainly share that with you, because that's quite an in-depth document. We'll talk a bit more about our peer review in a minute and our preparation, but we've got a lot of communication to do, and that that is ongoing all the time. If you think about it, we've got to be in a state of preparedness as an organisation all the way through the department all the time. So there's constant activity to make sure we're there, because if you think about it, a self-assessment needs to be an assessment of where we are when we're being assured. So it needs to be constantly updated. So it's all ongoing work. What I'm going to do next, but I might pause if there are questions, is as part of our preparation, we had, for want of a better word, a mock inspection back in January. That was done by the LGA and had a team of, I suppose, mock inspectors drawn from other councils from around the country. And I'll go through that in a minute. That was done back in January, so it's been quite a long time since then. But I suppose the reason for that was we did it, we then had to put the report came back to us, and then from a political point of view, we were into PERDA, and then we had quite a few elections, and we've only kind of just got going, haven't we, with a scrutiny cycle. So I'll go through what that says in a minute. Any questions for me or any of the team at this point?
As the middle section, you've got residents, people with lived experience. How much do you actually communicate with people who are in the front line, and how do you get their experiences, and how do you talk to them?
It's a good question. I'm gonna open that out to the rest of the team. Who wants to come in and talk about that?
So there's a number of ways that they'll be looking at speaking to the residents. The case file audits will be the key part of it. We identify 50 cases, and as part of that, they will drill that down to, am I going to get this right, 10? And they will then go and speak with those individuals. We won't be present. They will be able to ask whatever they wish of those 10 residents. So it's actually quite a small number that they'll be looking at, and they're trying to track their journey from beginning to end and make sure that that journey has been a good one for them with really good outcomes. But throughout the self-assessment, we've had to seek our residents and our customers' opinions, and that formulates part of the evidence. There's a huge pack of evidence that we have to submit in advance, and part of that will be our customer feedback forms, gathering the views on a number of things that we'll have done. In addition to that, I think you'll be aware of Social Care Future, which is our movement, as it were, to include residents and customers in everything we do. So big focus of the self-assessment has been the work that we've been doing with Social Care Future to make sure that individuals that are at the heart of what we're doing. So they've been able to give their very clear views on what we're doing, whether we're doing it right, and steering it in the right direction. So we hope that our self-assessment will be able to demonstrate our journey to show that it's not just us saying that we're doing things okay, that our customers are agreeing with it.
How do you actually choose these 50 people that you go to 10? So are they people who would be outright in their opinions, or are they people that would happily go with the...
That is a really good question, because different authorities have done that in different ways. Now, we've always been quite an open local authority. So for our peer review, we had to submit a number of cases in exactly the same way, and we went for a warts and all approach in terms of those cases that might be very, very complex, and showed the journey through that. some not always the best feedback, but good outcomes for the customers. It appears that the journey of CQC has taken people in different directions. I think it's fair in terms of how they select those cases, because people want to put their best foot forward. So at the moment we've simply got we've brought somebody into an assurance role to identify cases that we can show the complexity of the work that we're doing. We can be honest, but we can also put our best foot forward as best we can. Part of the difficulty is that they want you to have worked with that customer within the last 12 months. So actually, we might have 50 cases last week, but by the following week, those cases are changing all the time. So the cases that we're choosing are very different. So whenever we get that call, we'll have to then make a decision on which 50 we put forward, and then they will choose the 10. Is that okay? It's not easy.
Becca.
I just wanted to ask if you've kind of picked the brains of any of the other local authorities that have been through this process to get any tips, not in a negative, but you as an authority have got to work through this. What's the best way to do it?
Short answer, yes. The CQC, it's fair to say this is their first year of doing this, and how they've approached it and some of the logistics of that has changed quite rapidly. So I suppose as we're part of a southeast region of DASs, of councils and social care, and there's a whole departments, and there's a whole kind of sort of industry around how we're helping each other prepare, sharing feedback of the authorities that have been through it, et cetera, et cetera. So we've done quite a lot of that, and some of that's helpful, some of it isn't, because I think different authorities have had quite different experiences. So you can fall into the trap of thinking, well, I've spoken to that authority, so I know what's going to happen, and then get caught out. So there's been quite a lot of that in preparation, and the peer review that I'll talk about in a minute. That's been formed on the basis of the learning from some of those. So it's as close to the real thing as possible.
Caroline.
Just a quick question about the interviewees. You say you choose them randomly, and I presume they're supported through the process. If somebody doesn't want to be interviewed, are they allowed to say no? Thank you.
Yeah, that is a really, really good question. We have to have the customer's consent to speak to it. So that's another difficult situation as well, because we might have someone that we've worked with really, really positively, but if they don't want to be involved in the interview process, they absolutely don't have to be at all. So to begin with, we have to have people's consent.
Thank you. You mentioned a few moments ago just the sheer amount of work that goes into being prepared for that. I was just wondering what kind of impact that has on your team and resources in terms of then focusing on the assessment outside of then the actual delivery of services.
Yeah. So in terms of the impact of resources, so we have got some capacity to support the assurance process. As Matt said, it's a big process, and it needs to be constantly updated so that we can put our best foot forward when the inspector comes. So there is additional resource here to support us through that. And then collectively, Lisa and I, we have a working group, so we're constantly looking at our progression in terms of our self-assessment and where we need to go to next in terms of delivering that as well. So it's something that we keep under close observation all the time in terms of its development.
How much notice will you actually get in terms of when they will arrive on your doorstep?
3 weeks.
Oh, sorry, you said.
Pretty much. Yeah, and just to talk about the resources side of things, I suppose in some ways we've got quite a lot out of this in terms of a peer review and going through that as a team, focusing in on a self-assessment, making sure we really know ourselves. So there's some real benefits from this, but I would say having this, I suppose, bought in on top of with a kind of funding and resource crisis in adult social care does have its problems. You know, it is difficult, and having a long 6-month process, it is a strain. It is a strain for the department to do that and deliver an effective day job as well.
I think, yeah, the time periods, it does have a knock on, no doubt about it. But I think when we did our peer review, I think the clear thing that came out was that the staff really rose to the challenge. And one of the things you'll see was that one of the things they commended us on with the staff's enthusiasm and passion for the jobs that they were doing. So I think they got so much from it. And we're hoping that with a continued emphasis on that they'll do exactly the same, because they've got real pride in what they do.
I think Alice might have had her hand up for a while.
Thank you, Chair. Thank you, Beth. Just to make you all aware that we have been, as Healthwatch, we've been informed that the CQC will be having a conversation with us. So that's another way that they will get information about the public needs as well, because my counterpart in West Berkshire has been spoken to, and we have been informed by Healthwatch England that there is a chance that we will be asked.
I mean, I'd go a bit further than that, and I'd want that to happen, Alice. You know, as part of the process in working.
Thank you.
Your smile anyway, Alice, will reassure them. Just keep smiling. As just the final question, because I can't see any more hands up, what's the role, if any, for the HOSC in a face-to-face situation? I'm on school governing bodies, and we only get half a day's notice, so 3 weeks is luxury.
Well, I think a couple of things. I'd want to demonstrate to an inspection team that we've had a conversation about this, and that wherever you have felt you wanted to have follow-ups, we've done that. I think that's important. In terms of who they'd want to speak to, I don't understand that they've wanted to speak to a whole HOSC, but I think in some areas they've not talked to HOSC at all. In other areas they have wanted to speak to the chair. So, but I think that's not kind of test of what's in the self-assessment or the data return or anything. It's more about understanding how you have oversight and that sort of role.
Any further questions before we move on to the next peer challenge bit? No? Okay, would you like to carry on?
Nation number 2. So this happened way back in January. I explained why it's probably the first time it's come here now. Just waiting for Wes to fire up. So I mean, the idea, a very simple idea was if we had a dry run which was as close to the actual event as possible, we would get an enormous amount of learning from that. So that was the effort here, and this is the presentation there is a report as well, but this is the presentation feedback that we got from the chair. So let's just move. And as you can say, there's a disclaimer there because it's a LGA peer review mock process. They were not willing to say, you know, here's a judgment. That's not what it was about. It was more about what they found and whether we were ready. I think you can see there. Again, this was quite an undertaking for us back in January. 40 meetings. So how many days were they here? There were a couple of days, 3 days, 2.5, 40 meetings, 138 different people spoken to, 265 hours of you know, mock inspectors' time poring over data and all of that, you know, equivalent to 35 working days of scrutiny for the department. So it was quite a big, I'm just trying to remember back now because it's a lot's happened since then, but it was quite a big event back in January for us. So key messages. So there was an awful lot of positive, you know, an awful lot for us to be proud of in terms of adult social care in Wokingham. And I think sometimes it's good to get an outside in look because we do benchmark well against many other authorities. So it's good to have someone in from the outside to have a look at that. I don't think I'll go through all of them line by line, but there's some really good stuff there for us to be proud of. There's quite a few of these slides, so I will move through them. Do you want to just on the second one now? I think that's go back one slide. Yeah. So what's interesting about the self-assessment is so I suppose one of the key bits of learning we had is that I suppose going back 6 years, the Adult Social Care Department has been on quite a journey to change and improve. There's a lot of things that we've done across that period. What we did in our self-assessment was kind of take like a camera shot or a snapshot of where we were. Some of the strong feedback we had was that tell that journey, tell that story, because it's quite a good story to tell of improvement in Wokingham, but don't just do a kind of snapshot in time. So on the back of that, we have rewritten our self-assessment to show that journey. And you know, some of you are new members, some of you are older ones, but you will have been part of that in terms of splitting away from a people services, having a focused DAS, setting up a safeguarding service, bringing back some services from Optalis, strengthening department. There's a whole heap of stuff we've done over 6-7 year period. So if you remember, there were four themes. So the feedback here goes against those themes, and it's like things that they found that they thought were really good, and then things that we could probably think about working on. And that's how it sort of goes. So again, lots of, I think some of those things on there you might recognise: Social Care Futures Vision and Charter, the Joy app we've talked about here, some of the work we're doing around becoming a marmot borough, looking at inequalities around the borough, our use of, you know, it says tech there, so it's technology enabled care. So we've got a really good high performing team there that really does help people use technology in their home to stay independent. There's a lot of stuff there to celebrate and be proud of. Yeah, good. Sorry, by the time I've looked at you, it's changed. Some things there for us to have a think about, and we've taken some of that forward already. So Liz, you might just want to update people on what we've done in terms of transforming mental health services to have a renewed focus on social care.
So we've got adult and older adult mental health teams that are integrated with health colleagues from Berkshire Healthcare, and we're just realigning the staff basically so that it's become very complex, mental health and social care, over the years. And so we're going back to people's professional backgrounds. So if you're a social worker, you're doing social work. If you're a mental health nurse, you're doing the mental health part. So we're remaining integrated in the same building for all of those relationships that are really, really helpful. And we've appointed a social care service manager who will be starting in a few weeks, so that we can end up, we're sort of highlighting and renewing our social care to which I think will benefit people in the borough.
Okay, thanks, Liz. Moving on to theme 2. So this is people with lived experience and their feedback. Again, a bit like Lisa outlined, lots of good stuff there. It's good feedback. We've got some real strengths in what we're doing as a council. You know, some of you remember the Social Care Futures, the vision and the presentation to council and the sign up to that charter. That will come back in January, an update on that. There's an enormous amount of work that's happened across the year. So some really good stuff there. Considerations, timeliness of assessments and contacts with residents following referral. We've done a whole bit of work there to relook at our pathway and our kind of front door to improve some of that. But it in a big complex system that is struggling to keep up with demand, making sure people are seen in a timely way and communicated with regularly is a constant piece of work to keep on top of that. Again, more strengths there. We've done a whole piece of work around domestic violence with the department across the council. The voluntary sector, we've done some great work there. You know, people will know the hub's been open a while now. You know, there was some really stuff the inspectors saw that they thought was really good, you know, that they didn't see in other places. So that was good. Some work around self-funders and understanding ourselves there. We have commissioned a bit of work since then because it's been January, so we've moved along there. Something about working with the rest of the council to understand adult social care's issues and make some changes. Again, we've moved in that. Executive signed off expansion in time periods for disabled people who are disabled and have bus passes recently. You know, so we're seeing some cross council steps in the right direction to support adult social care as well. Again, lots of good stuff around safeguarding and safety. Some really good strengths there. We're really proud of you know, the investment in the adult safeguarding hub. You know, that's been up and running maybe 5 years now. It's a real strength for us. And just some improvement there. I know when it says transitional safeguarding around young people, so that's about moving from children's to adults and having a particular focus around developing our safeguarding practice in that area. And we've done some work on that since, but probably more to do. Leadership. Again, a bit embarrassing, I suppose, for me to go through some of that, but you know, that we came out well in that, in all the conversations they had around the organisation. So that was good. And then some areas perhaps to think about there. Certainly working, you know, I think we've talked about this here before, working with the NHS across a huge footprint with many local authorities, you know, Oxfordshire, Buckinghamshire and Berkshire West, is a constant issue in terms of getting our voice heard. We need to keep going on with that. So there was some things to think about in that area. I think that's it. So again, any questions you want to ask, let's do that. And if you want to see the reports, they can.
Rebecca.
2 questions. Firstly, where do you rate yourself? So you've obviously looked at this. Where do you think you are? And obviously also from this peer review, you've picked up quite a few different things. Has there been any changes that you've currently made that you're implementing because of this peer review?
I'll answer the first one in a minute, but did the team want to pick up on, because we've done quite a lot of stuff since the peer review to implement some of those changes.
Okay, so I think the first thing to say, and Matt picked up right at the beginning, in terms of the actual self-assessment itself and how that is structured and written and reflects our journey, reflects our understanding of some of the inequality issues within the borough and how we're able to articulate that. We've done a lot of work around our social care self-assessment and also that communication with staff to keep it relevant and keep it up to date in terms of the knowledge. There are wider issues in there, so I'll just pick up a couple of bits from my area. So it talks about self-funding and the market. So as Matt said, we've done some work really understanding our self-funders, really understanding the pressures within the market and how we need to create that sustainability within Wokingham for residents. There's been a lot of work to really build up our evidence base and our understanding so we can target our resources at the right place. And that's been a real big drive in the short term.
Yeah, just to add to that, a couple of the areas that they did highlight some of them. So we've made some considerable progress in the area of transitional safeguarding. So looking at the structures coming through, and we've done a huge amount under the Social Care Future umbrella. Actually, what we did was choose some of the themes that were highlighted there, and we've used them under Social Care Futures. So, for example, looking at our front door service, and we've basically redesigned that. We thought we knew what we needed to fix. We did the work under Social Care Future, speaking to our customers and our residents, and actually we've come up with something very, very different at the end. We've found their problems and their solutions. So it made us think about those areas, and I think we're making some really good progress, aren't we? Mental health is obviously a key area which we absolutely knew we needed to do more within, and Liz has made a really, really good start in that area. So I think we're making some good progress in terms of what they recommended.
I can see no more hands, but David, I wondered if you...
I haven't answered the first question yet.
If you wanted to say anything.
Sorry. No, I mean, I felt the self-assessment was very positive. Certainly, yes, they questioned me quite deeply and quite lengthily, but I was quite pleased with how positive it was, and also how well I've been briefed. I mean, that's something which we all need, and certainly I've been well briefed and knew not exactly what they were asked, but I knew the range of things and so on. And I was very pleased, as Matt said, with how well the staff reacted to it, because sometimes you think, oh, not another one, but they were very positive and almost enjoyed it. I mean, it sounds, but it sounds funny to say that, but they did. They felt they wanted to show what they were doing, and I think that's very positive, and it shows us in a good light, and so I was very pleased with that.
Sarah, sorry, I missed your hand.
Well, Rebecca asked 2 questions, and we dodged the first one by answering the second one. I suppose it is quite with a new inspection framework and regime that is developing all the time, and that has changed quite a lot. It's quite a difficult question, I suppose, in a public meeting for a director to say, you know, scientifically, I think this is where we are, because there are so many variables to that. What cases get looked at, what inspector you get, what, you know, what. So it's quite difficult to answer that. But if we weren't good or better, I'd be really disappointed. I think it's the honest answer. Sorry.
I mean, I'd just firstly like to say that I've actually had to interact quite regularly and ask for support from the adult social services teams since I've been elected, and yeah, and the support and the response has been really, really positive. I've been, you know, they've been so helpful. So just kind of thank you for that. One of the questions that's on page 27, the Working with People considerations page, the final point, how do you know and show you're serving all your residents equally and demonstrate your understanding of inequalities within a wealthy borough? Have you answered that question yet, in terms of how that measurement is being put in place and any outcomes from that yet? If not, I'd just be really interested in talking to you about that further or contributing on that as well. Please.
I think the short answer to that is we've done an enormous amount of work to understand inequalities in the borough, because we have had a focus on everyone says, you know, standard of living in Wokingham is really high, the quality of life is really high, and I know Ingrid, you know, she's online today, will say that's true, but on average. And do we really understand those people in the borough who experience inequality or inequality of outcome in life? And we've done quite a bit of work on that, which is just about to come to fruition. I don't know, Ingrid, are you able just to say a bit about where that inequalities programme is, and I think crucially when members will start to get to see the output of that as part of the Marmot programme?
Yeah, happy to. So one of the things, not just in this forum of the CQC and adult social care, but really across quite a few areas in different directorates, but sort of in public health too, one of our goals is to understand our population. And the way in which we would traditionally do that is by looking at nationally available data that helps to describe a population. But for us in Wokingham, when we do that, we don't see the detail that we need to see. So when we look at national level data for Wokingham, everything looks really rosy. So we're always really good compared to other local authorities. We're always green in indicators, but we know that that represents an average, and that really health and wealth in Wokingham is not evenly distributed, and that we need to understand the experience of everybody in our borough, not just those that are seen through those national data sets. So in order to try and understand that, we've done a lot of work around the data to really kind of unpack that. So for example, if you see something that says, well, this one's about children, but if we see something like school readiness, and we say on average 85% of children are ready for school, we need to ask a question and unpack that average and be curious and say, well, what lies behind that? So if that's the average for everybody, there's a proportion of people bringing up that average. So where is it that people are doing less well than that average? And we have to keep asking that question in Wokingham. And you can, in many instances, unpack that average and understand it. So that was one stream, looking at the data. The other stream was then talking to people. Unless we understand how people live in Wokingham, we really won't understand that difference in experience of well-being and outcomes. So we've done a project where we have spoken to about 45 residents from seldom heard communities, and we've talked to 45 community facing workers in some of our teams, talking to them about the things that give us the foundations for health and well-being. So what we call the building blocks, which give us the foundations across our life course to have that good experience of health and wealth and prosperity. So having an opportunity to thrive. So using that framework to say, what bits are not feeling so secure for you in your life here? And we've had a really rich conversations, and that project has finished. Those sort of discussions have finished, and we're in the process of writing that up and bringing that information together. It's forming part of the overall Marmot work, so that will come together in a much bigger piece. But this bit about the inequalities will be completed around mid-November. So after that, it should be widely available to discuss and show to colleagues and to whichever forum it's required.
Caroline.
Thank you. I'm sure when we get the inspection, it's going to be wonderful. I know it's going to be, but how do you get the feedback? Also, do we have the resources if we need some areas? So if they highlight something, do we have enough resources? And do they come back? And is it like Ofsted? If we have wonderful, it'd be 6 years. But if there's areas that need improvement, do they come back? And as you say, this is their first year. So hopefully we can answer that one. Thank you.
I mean, how we get the feedback is we get a draft report, and then we get to go through an iteration of that report, and then there will be a final report, and that report then gets published. That's sort of formally how we get the feedback. In terms of when they're going to come back, I think that's quite a good question, because I think the whole system is just focused on it starting and how they're going to get through all of them. Because if you look at that, going back to that map that we showed, there was still the majority of councils haven't had a notification yet. So I think it's unclear when they'll come back.
I think if you look at that map as well, their resources, CQCs, to actually complete the number of inspections has got to be taken into account as well, because obviously there's a density in certain areas, which you would assume that's where their teams are based. So it's gonna take a while.
I just wondered, like Ofsted, they will come back if they, because it won't happen to us, but other councils that are having problems, whether they go back, see they've improved, but we don't know. Thank you. They haven't. Oh, okay. Sorry.
Just one quick question. Within this assessment, do they assess your commissioning, the quality of your commissioning as well to private care providers?
Yes. So they will look at, as Matt said, they'll have access to information and data that's publicly available. We've done cost of care exercise. We have a market sustainability, market position statement. So they will look at all those things before coming. But yes, and it's a theme in the inspection itself. So we'll look at that.
And they also talk to providers as well, don't they?
Very good point. Yes, so they talk to providers, and we know providers often won't want to talk to people. So we're doing some additional work, how we can support our position as well. So at the moment we're doing a survey of all our providers to say, how are we doing? What's our current situation? Just so for our self-assessment and what we can provide the inspector a great depth of understanding.
And of course, in addition to that, lots of the adult social care direct care providers are inspected by the CQC separately.
The agenda item 19. See this, it's adult social care as well.
So it's us again. So we won't need to do a round of introductions again. So this is Q1 KPI report, and some of you will be used to this because it will come every quarter, 4 times a year. Some of you, it might be new to you. I won't go through each one of them one by one, but we will take questions, and it's all right, I think, for those that are new to ask clarification questions about, you know, the KPI, because this is the first time this year we need to get into a rhythm of looking at this through the year. There are 2 new KPIs, and that's around I suppose assessment and assessment timeliness. We've split that out just to try and make it a bit more detailed and meaningful. That's 1A and 1B. The other KPIs are the same as last year. As you can see, there's one red, and that's normally where people go to. That's around the number of admissions to residential and nursing care homes. So the reason we keep an eye on that is that good practice is to support people's independence as much as you possibly can in their home, in their own home, rather than moving people into a residential or nursing home. You'd only do that if it was absolutely appropriate for those people. That's why we look at that number and trying to keep it as low as we possibly can. We benchmark very well, and we do well there, but we are seeing more and more people needing, particularly nursing home placements, along with lots of other councils. It's a real issue and pressure for social care across the country. And as some of you will know, our strategy to that has been to purchase our own care home, Bluebell House. You know, that's part of our strategy to meet that need, but the numbers are rising. So that's the red one. There are some ambers as well, but I don't think I'll say much more other than let's have some questions and work through the report that way.
Matt, can I ask you why there's 2 from the bottom are green, but they're both worse? One is around safeguarding.
So, no. If performance people were here, what they would say is we have, you know, you will have a target, and if you're above that target, you're green. So you might be above that target, but actually coming down a bit, but still above the target. So you'll still be green. That's why it might say worse. You see what I mean? In the same way as amber, you know, there'll be a tolerance either side of the target, and then you'll move into an amber. So hopefully that explains that. So if we look at the detail of, let's choose AS7. Yeah. Well, we're still doing well. It's just we're doing less well than we were before. Do you know what I mean? So AS7 is 97%, isn't it? And the target is 90% or more. But we must have in the last period, we must have performed better than 97%. You know, that's why it says worse.
Rebecca.
AS1B about the assessment process. Now I know it says it's green, but I just look at it and think, God, 16 weeks is such a long time. So 2 kind of questions. Within the triage above, do you then, if there's anybody really flagged, will they move up that process to be prioritised within those 16 weeks? And also there's 27% of people that are going over 16 weeks. How long are they actually waiting?
Okay, so we changed the KPIs for these two. Our previous one, Rebecca, I don't know if you remember, was cases being allocated within 28 days. Now, I didn't like that measure because all it showed was that within 28 days, there was a named individual working with that person. That could mean that they went, you know, they stay open for a year and a half and the assessment period could be protracted, and we didn't have eyes on how long that intervention would take. So what we changed it to was having within a week, every single individual that comes through will be triaged and risk assessed. Everybody will be have an immediate service if they need them. So we know we're guaranteed that that risk level is reduced from the get-go. Then we've set the measure of from that point that that individual comes to adult social care, within a 16-week period, the assessment will be complete. So it's not about just being given a worker, which was the previous one. This is about a worker going in, doing an assessment, doing their support plan, reablement, whatever that might be in terms of the thing, and it will be finished within 4 weeks. Now, that's quite an ambitious target, given that a huge percentage of cases within, well, nationally actually, aren't even allocated until 6 months. So for us to complete all the work within 4 months is challenging, but we're trying to set it for ourselves because we appreciate that that work needs to happen. We want to try and drive cases being allocated, but then being finished as well, because things can drag. Human life gets in the way, and it's about us being able to really keep a close eye on that.
Sorry, what about those 27% that aren't reaching that target? Kind of how long are they waiting?
We could probably gather those stats, but they might be, so bearing in mind this is all the breadth of individuals that we're working with. So this might include those with a learning disability, whereby the interventions are slower. You might have advocates, you might have easy read, it might take longer to get that care and support in place. The same with perhaps hoarders who you can't engage. So we do break down so that we can understand those individuals where they go over, and we're keeping an eye if there are those that have simply gone over because we've been tardy or we need to get them done more. We're keeping an eye on that, but we do have a record in terms of themes that we can identify. For example, we have identified that hoarding is an area where cases can be left open for a long time because the response from individuals is very difficult, hard to get them to engage. It's about relationships. We are now looking at developing a brand new pathway for hoarding so that we can respond to those individuals in a different way.
On page 42, you're talking about the number of permanent admissions to residential and nursing care homes, and you've been increasing them. How is that affecting Wokingham Council in particular for the cost of this? Because not all of them will be self-funded. And is it going to be increasing our costs of this? And if so, where's the money coming from to pay for
So quite a big, fund, national funding question. I suppose is it a pressure? Absolutely, yes. Both in a kind of pressure in terms of work for the service, but also a growing financial pressure, definitely, and particularly nursing home placements. There is a national shortage as that supply gets more and more demand on it, the price goes up and up, and it's a real issue. And successive governments have, I suppose, danced around the issue of funding for adult social care, and we continue to campaign for you know, a long-term funding solution for adult social care, both us as a council, but also, you know, as a collective director of adult social care. So we await what the new government says about that. In terms of in-year pressure, it's managed at the moment, but it is a growing pressure for us.
Because the average cost is about £2,500 a week to put somebody in a nursing home, at least according to my other half, who was the head for finance for the, and saying that that's a lot of money. Looking at individuals trying to pay for their own, I don't know too many people who can afford that.
Some of it's a lot more than that.
I know. That was the average, he said. I know that Woking was charging £1,700 on an average for the new hospital, the new care home, but they just bought. But it's going to be £2,500, and some of them are £3,500 and things like this, and that is beyond the reach of almost everybody except very, very wealthy people. And if the council is responsible for it, where's the money? You know, what are you going to have to cut to do it?
I mean, this needs a national funding, adult social care funding solution. It's, you know, it's part of that needs resolving on a national level. All we can do is try and manage the pressures as best we can in the borough.
Talk to the Chancellor of the Exchequer.
We've written. I mean, we've written on several occasions, yes, but you know. But both the you know, the ruling party here for the council has done that, but also when we were when the opposition was leading the council, we wrote as well. It is an issue, and it's a particular issue in Wokingham of people running out of money and having high care costs.
Thank you. With AS6, it's all amber, and it's the percentage of CQC registered providers are rated good or outstanding. So the reason that it's amber is that basically the choice that you have is of providers who are only, you know, it's down to basically it's out of your control. It's to do with the choice of providers. And do you mind me asking if there are any that are in categories where we should be concerned?
Almost.
So as we said earlier, that so often care home provision or domiciliary care is obviously within the private sector, and this is CQC rating. In terms of the nursing home provision, which is the lower percentage point within the report, nursing homes are a small number, and we know of 3 which are currently not good or outstanding. And so that obviously has an impact on the statistics in terms of how it's reporting. If we talk about 10 care homes and 3 are currently not good or outstanding, which this is showing. So the 3 that aren't, one does include Bluebell House, which we purchased last year, and that was rated as inadequate before we purchased it. Now, we talked about CQC and coming back and how quickly that takes. Often it won't be a matter of urgency for them to come back in terms of a home like Bluebell House. So that has been, and we would welcome to come back and see the fantastic improvements that we've made at Bluebell House. So it's a point in time which they have been inspected, and there are 3 currently within Wokingham which are not rated as good or outstanding.
I just add to that. So yeah, so it is out of our control a little bit. However, we do have a care quality team, and their job are to go out and drive improvements in homes. So if we've got any concerns outside of the CQC cycle, they will go in there and actively work with the homes to try and make the improvements in all of those areas.
Yeah, because I imagine it's not as easy as just saying, right, we're going to stop with you and we're going to go and buy from somebody else down the road. So, yeah, that was one of the questions I was going to have, is how much do you then actually go in, even though they are private providers, obviously not in the case of Bluebell House, but you might work with them to help them improve rather than just close the door and open a new
And
one.
that care quality process and how we commission very much work hand in glove in terms of who we actually commission. But as you say, it's a constrained market and we have to work within the parameters of that.
And we work in partnership with health as well, to try and drive those improvements as well. So it's a real collaborative thing. And you've got a very, very strong team actually there. We're very lucky.
Any further questions? Can we move on? Okay. Next item on the agenda is on page 49, and it's the update from Health Watch. Alice, we're all yours. Sorry.
Good evening, everyone. I have shared a paper with you all, and I hope you all have had a look at it. And what I don't want to do is go in and talk every part of it. But if there is anything that you want to ask, please do ask, because I think that will be a lot easier than me going step by step. Would you like me to go step by step, or would you like me to wait and ask someone?
Yeah, I didn't hear you very well.
Can you hear me now? Can you hear me? Nope.
Yes.
Can you hear me?
Yes, I can.
So what I was trying to say is, I've shared with you all a paper, and I hope you all have read it, and I'm happy to take questions rather than go bit by bit, if that is okay. If you want me to present it, I'm happy to present as well. Which one would
Alice,
you
I
prefer?
think we should assume everyone's read it, but I've missed something for Matt.
No, I'm sorry. All I was saying is, do you mind if we left now? Or that's right. Okay. We didn't want to make any noise there because it was difficult to hear Alice. All right.
Thank you. Is there anything that you want me to talk about? I'm happy to have a conversation about it.
Okay, thank you, Alice. Is there anything that you want Alice to go into specifically? Or if not, do you have questions for her?
One of the things you're talking about is pharmacies in the borough, and there's supposed to be a new pharmacy opening in Winnish, but it's got to have a sign up, but I'm not sure when it's actually going to open. And we could probably use more pharmacies, especially if they're going to be doing more things for general practice, like giving flu shots, like giving them different kinds of other things that they can do to alleviate some of the pressure on the NHS. And how much are we checking to see how much they're actually doing for that?
As we are in constant conversation with the Thames Valley Pharmacy. They do share with us what's happening, but regarding the pharmacy procurement and details of that, I think it's a public health that deals with that. But we are observing and we are looking at it because it's something that nationally there's an issue about closures of pharmacies. So we know that that's happening. So we are just keeping an eye on it. But also we are planning to do a review on pharmacy first. So that will also have an impact on seeing how the pharmacies function.
Alice, I saw yesterday a list of pharmacies of Boots that were closing in the UK. I think there was 290. I checked, there weren't any in the borough as far as I saw, but I think it's probably only a matter of time, depending on where they are. But a lot closing very quickly as well.
I think it's more the bigger pharmacies, like the Boots, are the ones that are closing, but there are more smaller ones coming up as well. So there are there are small ones that we've observed that are also coming up to take the gap. Sorry, Ingrid.
I just wanted to ask a bit more about how you're empowering on the last one, the youth voice, how you're actually empowering young women on their sexual health. I just wanted a bit more background about it. Thank you.
It's okay. So one of our programs is about hearing the voice of young people. So so we recruited young people to be part of Health Watch, and they were the ones who asked to look at sexual health and women, and they are the ones who designed the survey. So and they are the ones who are going out to the community and getting feedback from the young people themselves. So that is how we are trying to get the feedback. So it's very much led by the young people. And also the report is going to be written by young people. And the young people, I mean by the age of 16 to 25. And a lot of them, started, majority of them are from Reading University, young persons. But we also have a mixture. But that is how, and they have a voice in this. And so far they've been going with the sexual health bus, doing surveys with them to try and understand how the service is like. And because they were the ones, the young people were the ones who told us that they were not given much information in schools regarding sexual health.
Thank you. That sounds a great idea, especially coming from the young themselves. Thank you.
Any further questions? You got away with it tonight, Alice. Not much work.
I mean, the thing is, I'm happy to come back and have, once most of the reports are out, I'm happy to come and present as well. It's just the fact that, we are doing a lot of work. And in fact, the only thing that I haven't added in here, which we are in planning, is we are looking at carers and looking at men who are carers no more. So what is the impact when they don't become carers? How do they feel about the whole change of life? So that's also will be coming out. We will be looking into as well.
Sorry, we've got some forward planning here on the back. Would you like to have a look at agenda item 21? It's on page 53, and look at what we've got coming up.
Sorry, so you'll see from the forward programme, we've tried to schedule some of the items which we had previously as unscheduled, and we've spoken to the relevant organisations as to when the most appropriate time for them to come would be. So you'll see winter pressure planning in November, so that fits in with the kind of the whole system planning. And then we have obviously our Health Watch update. January, we've scheduled hopefully an update on RBH. As you all know, things are moving on with the programme, hopefully. The Autism Strategy Action Plan has been penciled in for January. It's the most appropriate time for it to come in the process. And then we've got the KPIs coming back. In March, obviously a key issue for members has been dental services and pharmacy. So we've been advised by the ICB that actually March, because of the work that they're doing, would be the most appropriate time for them to give us an update, which would be most meaningful. We've still got some currently unscheduled topics. So I'll just highlight a few. Excuse me. So we've got domiciliary care, including the market position statement and adult social care workforce strategy. It says early 2025. We've got quite busy meetings that perhaps it doesn't look like in terms of number of items scheduled. So the suggestion would be you may wish to consider an extraordinary meeting in February, potentially, if this is something that you want to look at, because we've been advised that early 2025 is probably the best time. And in terms of vaping in primary school children, which has been on the schedule for a little while, officers are suggesting that you may wish to have a briefing paper on that in conjunction with the Children's Services Scrutiny Committee. And then you obviously, if there's something that comes out of that which you're wanting to look at further, then obviously we can schedule an item. So those are kind of the comments on that. If anyone had any other items they wanted to add.
And I'd just add to the vaping, licensing have been looking at this as well to look if we should sell, if vaping's being sold or vapes are being sold illegally to young children. And so it might be an idea to work together with licensing on that and put the whole thing together. Ingrid.
Thank you, Chair. Yeah, it was just to say, so will Public Health be leading on that? But I think that the vape, there's also legislation going through Parliament around vaping at the moment as well. So I think we just need to try and bring all that together. It's quite a big topic, vaping, and so I think what would be, and why this course of action was proposed, was to try and bring it together in one big, not big briefing paper, but bring it all together with the relevant departments all contributing, and then if councillors have specific or different various overview and scrutinies have specific issues around specific things that get raised in the briefing paper, we can do a more targeted and specific update to relevant committees rather than coming with a high level trying to cover everything in one go. So I hope that is acceptable.
Would you have any ideas of when?
Well, they're working on it now, Chair, so I would say before the end of the year, so around the paper is in draft. I know it is because it's going around different people, so within 3 months, I would say.
Okay, thank you. Caroline.
Hi, I just wonder for a suggestion with the removal of the fuel allowance for the people over a certain age, which I won't go into, would it be something that we could look at, see the impact on the health outcomes in the coming winter months, probably looking at it in February, see if there is a health impact on the vulnerable people over 60, whatever. You get the fuel allowance. That's not me. There's no personal interest at all in this. Thank you.
Ingrid, what are your thoughts on that and the timescale?
So we are looking at that question in our winter planning. So some of that may come out when we come back next month in our winter planning. So it might be worth having a bit of a broader discussion about it then. The difficulty we will have in terms of measuring the impact of that across winter is that we are not able to identify who's was in receipt of it and now not going to be in receipt of it. So we won't know how many, which of our residents on, it's difficult, going to be difficult to track that any poorer outcomes across winter will be due to that. It'll be difficult to draw out that causality. So maybe we can have a broader discussion about it next month when we bring that winter planning paper, and we can have a think about how we might look at the impact of that. And I'll think about it in the meantime as well, but the data behind it might be difficult for us to draw those conclusions.
Kay and I fall into that category in case we need to declare an interest. Rochelle.
One of the things you have on the docket for 29th of January is RBH. Now, as far as I have heard recently, the government has said they're not going to be refunding, they're not going to be funding RBH redo, though it desperately needs it. Top 2 floors and all the buildings are unusable. And anyway, we should be changing to WBH because it's going to be in Woking, probably not necessarily in Reading anymore. That's another story entirely. But they are doing one hospital in the area, but that's all. And it's not RBH, which is the one that needs it most, which doesn't make any sense. But government doesn't always make sense. I'll look at that.
I can give you a bit of an update on that because I'm a governor currently. The hospital have been told to carry on with the planning work that it's doing, and all of the Berkshire MPs have met together with the hospital trust and have gone back to whoever the minister is. And I know, sorry? And I know that at least one of our local MPs has written directly to him and asked for a meeting. It's the annual general meeting for the hospital, I think next week. If anyone wants to attend and find out what's going on, ask me for details and I'll let you have them.
Sorry, that's okay. Could I suggest that we keep it on the agenda, and then obviously if things change in between, we can be advised by the trust that it's either not the best time or yes.
Anything else? Thank you very much for attending. I hope the traffic's better as we go home than it was coming, and possibly it's not raining. Nice to see you all. Drive safely home.